Dr. Shultz, can you just talk a little bit about autonomic nervous system dysfunction in Huntington's?
Sure, but please cut me off because I like talking about it, so I am not here to give another talk. This all started from the Kids HD study and noticing that the kids with HD seemingly, and these are the kids who are decades from their predicted motor onset, so very young, relatively low CAG repeats. They had higher, not JHD, although we have a paper showing similarly that this phenomenon occurs in JHD as well, but there are subtle increases in blood pressure, heart rate, and body temperature in the kids with HD. And there's been some studies out there showing that there may be some very subtle cardiovascular changes in HD. That hasn't really held up a lot over time in various studies. It's a brain disease, so we are focused on, there are areas of the brain that talk to one another in a very coordinated fashion to help this system, this autonomic nervous system, maintain a balance. So there's two parts of the autonomic nervous system. One, it's the fight or flight reflex. So fight or flight is sympathetic, or the rest and digest is the parasympathetic. And normally they're in pretty perfect balance. Our brain helps us to maintain that balance. And seemingly those areas of the brain aren't talking to each other as they do in healthy patients, and that is associated with this change in blood pressure, heart rate, things like that. Last point, what we're focused on is why does that matter? And we're not exactly sure, but it's possible that could be associated with the progression of the disease. That's important because we can modulate the autonomic nervous system with medications that are available. So some of the medications are beta blockers, which are used normally for cardiovascular conditions. Clonidine is a medication that many of you may be a little bit more familiar with. It can be used sometimes for tics. It can also be used for ADD in kids, but it works in the brain to do a number of things, but one of those things is to decrease the output of the sympathetic nervous system, which is that fight or flight system.